Hello everyone, I am Dr. Sindhu working as a consultant neurologist and epileptologist in Lotus Hospital, Lakdi. Epilepsy treatment and management part. So, how do you see epilepsy and what do you have to do after if you are diagnosed as epilepsy? So, epilepsy is usually defined as two unprovoked seizures occurring at least 24 hours apart. So once you are diagnosed with epilepsy, usually the treatment is for years, usually 3 to 5 years at least. So once you are diagnosed with epilepsy, how do you diagnose with epilepsy? So usually the diagnosis is clinical. That is, if you have two seizures, documented and well witnessed seizures, then we can label someone as epilepsy. So witness is very important. See, somebody should see the event, because the patient himself cannot come and say that I had seizure, because during the seizure episode he is not aware of his surroundings and he will not know what has happened. So somebody, the witness who has observed, if they can time and tell the event how it has occurred, then that is enough for the diagnosis. So once if epilepsy, if seizures are there and two episodes at least 24 hours apart, then we can label them as epilepsy. So the diagnosis is completely clinical. The next investigations which we go for are EEG and MRI brain. So EEG will give you the functional status of the brain, that is the electrical discharges in the brain. So whenever there are sudden, brief, excessive discharges, that will be recorded in the EEG. So if any abnormality is seen, then in that area it is more probable that the patient can have seizures. So the next investigation we do is MRI brain. So this is to see the structural abnormalities of the brain. If any abnormality is present anywhere in the brain that could contribute for the seizures, then the treatment is for little longer. So once the structure EEG and MRI are done, but the probability of seeing any abnormalities is only 70%. In 30% of the cases, both EEG and MRI can be normal. Even then, if you are labeled as epilepsy, that is, if you had two seizures in your lifetime which are 24 hours apart, then you need treatment. The treatment is to prevent the further seizures. It is not for to get the seizures. So whether MRI is abnormal or not, or EEG is abnormal or not, you are going to have the treatment. It doesn't matter for the treatment. The next thing is, usually when once diagnosed with epilepsy, we start based on the type of the seizure and the better medication. Right now we have around 20 medications, anti-epileptic drugs available. So not that everybody will have side effects with the medication. So whichever is better for you, the doctor will decide and give you the best medication. So usually the treatment is given for 3 to 5 years. When one started with one medication, usually if we start medication for a person, then usually the remission rates are very good. That is 70% of the times with one medication you get full seizure freedom. That is, you won't get any further seizure. If you don't get any further seizure in the next 3 to 5 years, then we can try and stop the medication. Trying and stopping the medication also should be done under the doctor supervision. It is not just 3 years and you stop on yourself. So once when you stop the medication, if you get the seizure, then usually it is again given for a longer time. So if someone has epilepsy and once one drug is started, and even on then if you have one more seizure, usually the dose is increased or the drug is changed and seen. If you have again seizure, then usually a combination of drugs, that is one or two to first drug, the second drug is also added. So now we have drug resistant epilepsies. So usually drug resistant epilepsies are only 5 to 10%. So if you start treatment for epilepsy patient, usually 90% of the times usually they are controlled with the medications. Only 5 to 10% will not have control over with the medications. Then we investigate for the further investigations. In pre-surgical workup, we do long-term video monitoring of the video EEG. That is, we monitor for 3 to 4 days. We record seizures and the EEG for about 3 to 4 days, so that we can see from where the seizures are originating. And the next we do is MRI brain, which is a 3 Tesla MRI brain. An advanced MRI brain is done to see for the lesions in the brain. The structural abnormalities are better detected. And in some cases, we do PET scan and SPECT scans also to evaluate the lesion better. So if any lesion is found, usually if in one part of the brain, if any lesion is found and that is causing the seizures continuously, usually we can go for a surgical procedure. If everything points to one, then the idea is to remove that area of the brain so that he can become seizure free. And surgery success rate at present is around 60%. So not everybody can go for the surgery. If somebody is very much preserved with medication, that is you don't have, your seizure free with anti-epileptic drugs, then the treatment is anti-epileptic drugs only. We do pre-surgical workup and surgical workup only for the patients who are not seizure free even on medications. So you can come to us, then we can evaluate for the drug resistant epilepsy, that is who are not seizure free even after 2 or 3 medications. If they are using and still not seizure free, then we evaluate for the surgical causes.
Lotus Hospitals is one of the leading brands for all your health needs. You can visit our expert doctors at any of the centers: Lakdi, Kukatpally, Nagar, and Vizag. For booking an appointment, you can use our app or visit www.lotushospitals.in or call on 040 4040 4444.